Hi, I'm Santa Clara County Supervisor Dave Cortese, and if you've been following the Saturday afternoon COVID-19 updates that we run out of the Viet Bay studio here, which donates this opportunity to the County of Santa Clara. If you've been following us, welcome back. If you're new to this, this is really a conversation, oftentimes between me and a special guest, and that will be the case today. But more importantly, it's an opportunity to have a little bit of a conversation. If you want to have one, you can dial in, you can text in, you can put your questions on Facebook, and there's somebody here picking those up on the Facebook Live. So all of that information is on the screen. Take a look at that banner on the screen if you're wondering how to get to us. This is a huge opportunity today, I think, to get questions that have been on your mind in front of Dr. Marty Fensterscheib. I'm going to introduce him just a little bit more in a moment, but let me do my usual thing and tell you what it's been like over the past week since we did this last Saturday. As of Friday, yesterday, July 31st, there were 9,913 confirmed cases of COVID-19 in the county, which is an increase of 1,194 just since our last town hall on July 25th. There are 191 deaths now, an increase of 8. And as I always emphasize, for me, it's just something that I focus on. The mortality or the death rate on a weekly basis is something that I think is important for a couple of reasons. Obviously, the human loss and the grief that we should stop and acknowledge for those members of the community that have been lost, but also because as that number moves up and down, it's somewhat of a real indicator of the damage that COVID-19 is doing or not in the community. You've seen that as low as 2 per week. You've seen it up in double digits. For the past week, it was officially 8. So that is more than it was a couple weeks ago. You'll remember, if you've watched this on Saturdays, us talking about the fact that we were comforted, despite the loss of a couple of deaths, that it was getting down into very low single digits for a while. So far, 359,661 people in Santa Clara County have been tested, and that's something that a lot of you have questions about, and Dr. Fensterscheib is going to be able to talk to today. The fact that that many people have been tested, which I think is starting to become a good number, is really largely due to his expertise and his coming into the county to help us with this particular part of dealing with COVID-19. We have 3.5% positives among those tests. And the average turnaround for tests in the county-run facilities is running about 4 days. And we'll talk about that, I'm sure, a little bit more, because there's county facilities and there's non-county facilities. And I know that's something that people will want to talk about. The last thing I want to say for now is that we have 178 people hospitalized. And many of you know that we opened up for a couple of days some salons and some kinds of businesses indoors based on a new scheme from the Public Health Department that, frankly, many of us were really pleased to see, because it seemed to finally put a better kind of a metric on who should open and who shouldn't than maybe what we've had in the past. The governor came in and said, you're on the watch list, and a couple days later those businesses had to either shut down or move outdoors, as the case might be. And that said, what the governor's taking a look at, probably as much as any other indicator, is the hospitalization rate. And I would love to tell you that's going down, but it's not. We were here just a few weeks ago and that number was 64. Today it's 178. And so it's moving up pretty quickly, and this is once again where the community has to come together, I think, to try to flatten the curve, or at least lower those hospitalization numbers as soon as we can. With that, let me tell you about Dr. Fensterscheib. I got to work with him for a while. I've been a county supervisor for 11 and a half years, an elected official in the county. When I first started, Dr. Fensterscheib was at the county. He had been at the county for a number of years, probably about 20 years at that time, or maybe longer. I know that he spent 30 years approximately in the public health department. I saw him firsthand in action in around 2002, 2003. I think it was 2002 with the H1N1 pandemic. It was the first pandemic I really had become aware of as an adult, as an elected official, as something that needed a really rapid response. And I was really impressed then at Dr. Fensterscheib's ability to mobilize tremendous resources. What I remember about that, and we'll talk about it more later, is having at some point a vaccine where we could just open up the fairgrounds and other facilities and start vaccinating people. We're still waiting for something like that now. Dr. Fensterscheib, some people refer to him as Dr. Marty, returned in May of this year to be the county testing officer to ramp up COVID-19 testing. I think he's done a remarkable job. There's 50 testing sites. He's taken us from testing about 1,000 people a day back then in May, probably late May, we were still only at about 1,000, to about 4,000 a day now, and some days much more than that. So he has extensive experience with infectious diseases. Maybe he'll have a chance to talk about that in between questions, including HIV/AIDS, West Nile virus. I mentioned H1N1. And I think he's just an absolute expert in the field. So we're blessed to have him. I hope that alone gives people some assurance that in this county we have some of the top people available really in the country to deal with this. So when we struggle with hospitalizations and things, it's not because of a lack of effort or expertise or experience. It's just a very vicious virus that we're dealing with. Dr. Fensterscheib, before we take the first questions, maybe you could say a few words of introduction. Again, thank you so much for being here. It's always been not only a joy to work with you, but to kind of look up to you as an expert in the field, as someone who's on the policy side as an elected official. So again, welcome.
Thank you very much, Supervisor Cortese, and I'm really happy to be here. I'm happy to be back. You know, I retired, as you mentioned, in 2013 after being with the county for some time, and I love public health. So I was taking some time off and enjoying myself until this happened, and so I'm back. You know, I kind of say I failed retirement for the time being, but I'm happy to be back, although it's not a happy occasion whatsoever. This is a relentless virus. I think a lot of people continue to be in denial over this, and when we go about our everyday activities, sometimes we don't see evidence of it, but it's out there, and we have to just be so vigilant about being very, very good about wearing our masks, and we'll talk more about that. But I'm working now in the county's Emergency Operations Center, so that's been activated for I think we're on their 26th week of activation, which is just unheard of usually. Usually these things are activated maybe for an earthquake or something small that happens, and we do a lot of activities for a few weeks and then it closes down. We've been actively there for 26 weeks. I was brought back to work, as you mentioned, to bring up the testing. The county in general has been doing an absolutely excellent job. Dr. Sarah Cody, the health officer who I worked with for many, many years. In fact, I hired her in 1998, and it was a good hire, I would say. But anyway, we work well together, and I'm here to help her. So anyway, let's get to the questions, and I'm sure a lot more information will come out.
Yeah, we'll get a little more chance to chat in between.
Sure.
And I want to mention we have Tara from my office, Tara Srikrishnan, who's Chief of Staff in my office. 6 feet apart, you can't see her on the screen. Janice Rombeck from Communications in my office, Tevu Nguyen, and our production man, Min, who's part of the donated time here. So Tara's going to handle the questions.
Yeah, so this question is from Ray, and Ray asks, I'd be interested if Dr. Fensterscheib could address the percent of tests that are completed in 1 hour, in 24 hours, etc. Also, what is the percent of false negatives and false positives in each category?
That's a specific question for you.
Yeah,
right off the
I'm
bat.
not sure I quite understand the meaning of one test every so often, but there are a lot of different types of tests that you may have heard of, and the one that we're most utilizing right now is called the PCR test, and that's actually testing for somebody at the time of testing them to see if they actually are infected with the virus. And so that's what we're using now. If you become infected with the virus, usually you may begin shedding the virus a couple days before you develop symptoms till several days later. We like to do the testing of those people early on, and that test will tell us then, if it turns out positive, that you actually have the virus. So very important. We test a lot of people. When you come in to be tested, the specimen then goes to the laboratory, and that's where we've had a little bit of delay. These laboratories are so backed up right now that sometimes, I think with some of the commercial labs, it's taking 10 to 15 days to get the results back, which really is not good. It's really not good. The county and other facilities are doing a better job, I think, than some of the commercial labs, and we're turning those tests around in just a few days. When you get the result back, it's either negative or positive, and if it's positive, then we have to deal with putting you in away from everybody else. But perhaps, I'm not sure I answered that question. We're doing a heck of a lot of testing in the county. A little bit about who we should test, I think, is important because I think it's critical that we test people in 3 categories for the most part. The first category are people who actually have symptoms of COVID-19. So you may be at home and start developing symptoms that you think, maybe I have COVID, and you say, well, all right, I need to be tested, so we want you to go in. We don't want you to go to one of our pop-up sites where you actually have to stand in line with other people. So please, if you do have symptoms, call your provider and make arrangements to go in. There's also some drive-through facilities that Valley Medical Center has, so you'll stay in your car to be tested. So we don't want you to be in line if you have symptoms. Mm-hmm. If somebody has told you you're positive, that you were actually exposed to somebody who was a positive, so you're a contact now, then we want you to be tested right away also. Mm. And then finally, the third category are people who have been basically working out in the community. We call them frontline workers. And so frontline workers are the people that are helping you in the grocery store, people that are working in outdoor restaurants, and maybe they're making the food, maybe they're waiting on you, and also people perhaps that are driving the buses and transportation for you. So those types of people, plus our first responders, those are the people that we really want to make sure are tested. If you have been in your house and doing a good job of just staying home, maybe not happy about it, but you've been staying home and haven't really had any exposure, then your risk is really low. You don't need to be tested. You do not need to be tested unless you have had some potential exposure. So right now we're challenged with being able to handle all these tests, but yet we did a lot to increase the demand. We want people to be tested, and it's the only way we're going to identify infected people so that we can then keep them away from others and identify their contacts and hopefully get the number of cases down in this county.
Yeah, maybe we'll get a chance to talk about it some more later on. I'm sure there'll be more testing questions, but it struck me as an elected official that from the very beginning of this, we haven't had a situation where labs opened up quickly. In fact, they were slow to open up early. We couldn't almost get anybody tested except the most severe cases early on because even the commercial labs weren't available early. And then the national government, compared to some earlier times in my career, seems to have not done its part of saying all hands on deck, this has to happen, all labs have to start focusing on it. I mean, there hasn't been those kind of directives. So I know there are some differences, and it'll probably come up in terms of the county's turnaround time on its own facilities that you're mobilizing versus some of the other ones around town. We've heard some complaints about, and we'll get to that, I'm sure. Tara?
Yeah, and quite a few people have written in and asked how we can encourage community members to wear masks and wear them correctly even when they're outdoors. And Guadalupe even asks, how can we enforce this in our county?
Those are always good questions. Early on, we weren't even sure about masking. If you can remember way back, and it wasn't so much we didn't want people to wear masks, but we didn't have enough masks. And most of the masks we were trying to save for the people that were working in hospitals, taking care of people. But it soon became very evident that we could really do a lot of good by protecting each other. And when I wear my mask, I'm protecting people that are close to me, and when they wear their mask, they're protecting me. So I think we need to we need to realize that doing that is something that you then take responsibility of protecting your family, your friends, your neighbors, coworkers, whatnot. You're right. People are not wearing their mask 100% of the time, and the more data I read tells me that if everybody really wore their mask 90 to 100% of the time, our numbers of cases, as you read initially, would drop tremendously. But we're not doing it. I see people in my neighborhood on the street that are not wearing their mask, or they're not wearing them correctly. So if you're wearing one and it drops below your nose and your nose is then exposed, that's not doing any good. So you must make sure you have a good tight fitting mask, that it stays above your nose and that you wear it. Now, do you have to wear it all the time? If you're driving around in your own car, you don't need to have a mask on. If you're at home with your family, you don't need to have a mask on. If it's late at night and you're out for a walk, or even in a place where there's nobody around, you should bring your mask just in case, but you don't need to have it on every second. But if you're walking around in any neighborhood where there's a number of people and you're going to come into fairly close contact, leave your mask on. Try to wear your mask as much as you can and consistently. I think that's the main thing. And wear it correctly, and wash it and keep it clean, or get a new mask.
Yes, and you can see today we will be wearing these masks through the entire program, and we haven't always done that earlier in the programs here on Saturdays on the basis that we have a very small group, 6 feet apart, and technically, you can operate without a mask in the environment that we're in, but it has become such an issue, I think, for us to really walk the talk, and I appreciate you emphasizing that, Dr. Fensterscheid, that sometimes I wonder about some of the role models in our community. I'm a big baseball fan, but I tried to watch an inning the other night, and I was frustrated by the fact that even there you see what appears to be inconsistency as to the players wearing masks while they're on the bench and everything. On national television, come on, guys, let's be role models for the community, and let's not give people the impression that you can drop your guard right now. It's just not a good time to do that.
Somebody was asking about, didn't mention the enforcement issue. Well, you would probably know better than I, dealing with enforcement with the county for a lot of things, but we don't have enough police and sheriffs to be walking around and checking, and we wouldn't want to do that because they would then not be able to do the job that they really should be doing. So I think a gentle reminder to people that we kind of self-enforce each other, and if somebody maybe mentions it to you, gee, you don't have your mask on, or you forget, don't get angry with them. Just say thank you. Thank you for telling me that. And you can do the same with someone else. So if we enforce each other and keep each other safe, I think it's just saying we care about you. Yeah. And if they say it to us, they're saying I care about you too. So I think that's the way we should look at that.
Wonderful advice. Tara?
Yeah, so questions texted in. Given that transmission seems to be mostly airborne, how important is ventilation in conjunction with mask wearing and social distancing as a risk mitigation measure?
Well, we were just talking about that right before the camera started rolling, so maybe
exactly.
You can fill everybody in.
So we're dealing with the way we're actually responding right now is not so much the various entities closing or opening. We're looking at what the risk is and the activities that we do. So if you want to really keep your risk low, things that you do are in the outside or outside are safer than inside. Again, and you mentioned that in the question about ventilation. Well, sure. We're in a room right now which is rather small, and there's not a lot of ventilation. So again, there's not going to be the removal of those potential particles from this air here. It's going to be fairly stagnant. So outside better than inside. And if you are outside, again, keep your mask on because it's going to protect you, like we just talked about, for those reasons, to wash your hands and keep your safe distance. So all those, there's not one that's more important than the other. So if you do a mask, that doesn't mean I can get closer to somebody or I don't have to wash my hands. It's all three. So stay your distance. Outside is always better, and sometimes even at home, if you want to increase that circulation, open the windows. That will get the air moving even better. So outside, inside with windows open if you need to. Keep the masks on all the time and do the best you can to stay your distance from each other.
How about shared air conditioning? A lot of old buildings, and I know probably more than the average person about that because I used to be in the business of property management and such before I became a full-time elected official. But there's still buildings around that have one air conditioning unit for maybe 6 or 7 different offices under one roof. And you worry, in my mind, that maybe those are good to avoid, especially during peak hours during the day, if they're actually circulating the air. I don't want to say too much, but they're circulating reused air from one building to another. And are those things for people to be mindful of, or is it just too much to worry about? What are your thoughts on that?
It is a lot to be thinking about. I think initially we pretty much thought that this virus was just spread through droplets, so that like when you cough or sneeze, you can see the secretions, the moisture come out of your mouth or your nose. And we think that the virus particles actually grab on and cling to those little particles, and then eventually they drop to the floor. So that's where we got that 6-foot distance. So normally if you're speaking, and something comes out of your mouth, those droplets, they will usually drop before 6 feet. So that's why the distance, that's why the mask, because those droplets can't get through. And however, new data is telling us maybe these particles are just floating around by themselves in the air. And that's what we call aerosolization. So we're not sure, but it looks like aerosolization may play a role. And so yes, if it's just floating around, then we worry a lot. I don't think we definitively know that. We certainly know in places where there's lots of virus, so in hospitals and places like that, we have to really make sure that people have proper PPE, personal protection on. So more to come on that area. But again, the viruses are in your throat and in your nose, so you want to keep those areas covered.
Well, that's a very clear explanation. Thank you. Tara?
Yeah, so as Supervisor Cortese predicted, we have a few questions about test result timings. For instance, what is the county doing to ensure test results are coming back quickly?
Yeah.
And if I could preface and just say, especially since we get so much constituent email and complaints and such, and I know the Emergency Operations Center does too. I think there's hundreds and hundreds of emails that are handled there. But I think there's some confusion. As recently as this morning, a very sophisticated person in the community called and on my iPhone and was complaining about a 12-day wait from a facility at the fairgrounds. And he said, come on, it's a county fairgrounds. I said, yeah, but the operator there is not a county operator, and so I'll have to register that complaint with the Emergency Operations Center. But I think it's something you're already quite aware of. Maybe it's helpful today to explain a little bit about why everything isn't more uniform and what's really happening out there.
Right, and everything is totally not uniform. So that's one way to begin with it. It's totally not uniform. So even if we get the tests done pretty quickly, we have to send them off to a laboratory. And sometimes those laboratories are, like with the county, they may be right in our own Valley Medical Center laboratory or in the public health laboratory or perhaps in a hospital laboratory. However, in some of those places that you go to be tested, such as the fairgrounds or in the PAL Stadium, which is going to be moved, they don't use our laboratories. They send their laboratory specimens off to some of those commercial labs. And you've heard of those, Quest, LabCorp. And so they're national laboratories. They're getting lab specimens from all over the state, all over the country. And they are so backed up that they can't turn the results around for what used to be 4 or 5 days, then 7, 8 days, and now it's 10 to 15 days. So that's I mean, that's just too long. It doesn't help us because by the time we get the result, you probably are over what you've had. You've probably already exposed people, and they may already have symptoms and have exposed other people. So in dealing with these infectious diseases, it's critical that we get people tested as soon as we can that are at risk, that we get the lab back quickly, and then we can do the contact investigation and find out maybe who else was exposed and make sure they're protected. So it's an ongoing issue. The county has been we want to make sure our lab specimens and all our pop-up sites turn around quickly, and we're working in the lab. We're also looking at other laboratories in the state that have capacity that we're sending, and we are sending some of our labs to them.
Yeah. So I guess a helpful tip is not that we want the county sites to be overrun, but when you get those emails and things that say these are county pop-up sites, at least you know the turnaround time is probably a little bit quicker right now, at least, than some of the commercial labs. And then there's people who come to us as elected officials, and again, I'm sure you hear it as to, like, why can't you give them a kick in the rear and, you know, get them going? You're the county. Dr. Cody seems to have these broad sweeping powers. Why doesn't she just order these lab results to be quicker? And again, it occurs to me that we don't have that much authority to interfere with or cause the private labs to hire more people or something.
Right.
But a national effort probably could have done that by now. Is that your opinion, having worked in this field for so long?
Absolutely. And unabashedly, I'll say that there has been no federal effort as far as testing goes. When we had the H1N1 back then, and just to show you, the federal government can get the testing going nationally. It has the capacity, because right now we're working against everyone else. We're all trying to find the same reagents, the same chemicals, whether it's in the community, whether it's every state is trying to outbuy somebody else. That should have been done at the state, at the federal level. They should have set up the testing sites and made those available to everybody, and I think we would be much better off. So unfortunately, because that didn't happen, we're all basically working for ourselves to try to make this happen. So it's unfortunate, but we're doing the best we can, I think, in this circumstance.
Well, I think that helps explain things a little bit for folks as to who has the power and who doesn't on some of these issues. Thank you, Tara. Another one?
So the next question is, do you agree with the assessment that we have now reached a peak and are moving into a new plateau phase?
Boy, I can't answer that one. It doesn't seem to me like we've plateaued yet. It seems like it could just as easily be the beginning of an even bigger surge. Is there any science on that at the moment, Doctor?
Well, we follow our testing, our testing results. We follow our case results for the people. Now, we have seen more cases because we are doing more testing. So, I mean, but also, in addition to the find that we're finding people that are tested, that are positive and are out there that we didn't know, there's also additional spread. So you have two things. If you do a lot of testing, you'll find people that are already infected. But we also know, in addition, there's people who are spreading it to over and over to other people, and they are exposing others. So when we look at cases, the cases continue to get up, and you reported already what they were last week and what they are this week. We're seeing hundreds of cases every day that are coming into us, whereas a couple months ago we were 15, 20 cases. Now we're 200 cases, 250 cases. So we would like to see a plateau, but the curve continues to go up right now. That's the problem.
Thank you. And in case you just got on Facebook Live or just tuned in, we're here with Dr. Marty Fensterscheib, a longtime veteran of dealing with pandemics and these kind of viruses, if there is such a thing as this kind of virus, I suppose. And he's running the testing operation for the county. So again, if you've just tuned in and wonder who's talking here, I just want to make sure people know it's a great opportunity to text or call in a question to Dr. Marty. Tara?
So the next question is, where are we with regard to the accuracy of antibody tests?
So I mentioned that there are a couple different types of tests, and I just mentioned the PCR test, which is looking for the actual active virus that's inside of you to say you're infected now. If you then want to look to see whether maybe you were infected in the past, we need to do a different type of test. So we're not looking for active virus, we're looking for your body's response to being infected. And that requires a different test, and that's an antibody test. because we're actually looking for the presence of your fighting cells, your immune cells that have developed in response to being infected. So there are some antibody tests out there. There are a lot of antibody tests out there, and luckily at least the FDA has decided that they require that they certify those tests, but still they're not that accurate. So if you get a test and it comes back positive, we have found that some of those will be actually not positive, they'll be negative. And some that have come out and they're negative turn out to be they're positive. So we get these false positives, false negatives as we call them. So the accuracy is not there yet. We hope over time they will perfect that test to make it more accurate for us. The other thing is on that is that normally when you say I have antibodies, that means I'm immune. So I'm protected. I can now go out, take off my mask, go out there, and I'm okay. Well, not so. We don't think that these antibodies necessarily in all instances are totally protective, or that they last that long. We think now they last about 2 to 3 months, and it depends on perhaps how severe an infection you have to the degree of antibodies that were developed. So we're just not hanging our hat on those antibodies quite yet.
I guess there's hope, and I know people don't want to hear their public officials or elected officials hanging their hat on hope too much. But when you're waiting for science and medicine to catch up with something like this, in a sense, there is a little bit of hope involved, that not that they'll ever come up with it, but that they'll come up with it soon enough for us to stave off some of the damage that that people are feeling right now, and some of the loss of life. And I can understand the question. Tara.
So Catherine on Facebook asks what we're doing with people in our county jails.
Well, that is an area that has been focused on not only here but in the state prison system as well. And maybe we can answer that question about the county. I know there's rigorous efforts going on. The sheriff oversees the day-to-day operations of the jails in this county, and she has tremendous authority to act on her own. The county board of supervisors controls her budget, and certainly persuades her, as does the public health department, as to what to do. And of course, I know they have instituted protocols and even released low-level offenders at some point to try to create space and distance where they wouldn't have had that. But clusters in congregate facilities, whether they're prisons or senior care facilities, we're worried about schools. Can you talk about that a little bit more, even just in the context? I want you to answer the question, but also it strikes me that these congregate facilities where there's people crowded together is a similar issue to some of the other ones we're talking about, outdoor versus indoor. That it's something you want to avoid, is people in close proximity for long periods of time. No?
Yes. And those are congregate care, meaning they're kind of clumped together, and they can't really move around much. So as the question came, that's a jail. People are in the jail. They're not coming and going from jail. They're in jail, and then you have staff working with them. People in skilled nursing facilities, older people, frail people that are at highest risk, they're not going anywhere either. And right now they're not even allowed to have visitors, but staff are there taking care of them. Shelters also, and again, people are congregated in there. So those are areas where obviously people are very close together. So we worry very much about them, especially in skilled nursing facilities. If a couple people get sick there, it could be devastating for that. But we are doing testing in all of those areas. The skilled nursing facilities have testing done, not so much on all the residents all the time, the elderly, but the staff. Because without visitors, how are you going to get infected? You're going to have a staff person bring it in and infect somebody. So in fact, the state has required all the staff to be tested on a monthly basis. We have the Valley Homeless Project that's out there doing the shelters and other sites. And we also have the jail medical staff that's testing all the inmates. So if you get booked into the jail, meaning you get arrested and you come and you're going to stay in jail for a little while till we figure things out, you get screened initially and you get tested. And then you put in a holding area and waiting till that result comes back, and then putting you into the main area. But still, we still have cases pop up in all of those areas, and we need to be on top of them. As soon as we find one, we get in there, test everybody, find anybody that's infected, and separate them from everyone else. So that's a challenge, no question.
And I know the response in terms of testing, much like for the general population, has dramatically increased in these congregate facilities. In other words, as this learning occurred about congregate facilities, my understanding is gatekeepers have been created to make sure people don't come in and out that are spreaders, and then testing has been required much more vigorously than perhaps last April or before that. Is that true?
That is true, and we didn't have as much testing, so now we have it, and we're making sure that we don't bring somebody into these areas that we know could be infected. We want to make sure we screen them. As I mentioned, in skilled nursing facilities, we're very, very cautious and very protective of the people in those facilities to make sure that a staff member doesn't inadvertently get sick and bring the infection in. So we test them on a regular basis. So everyone is trying to be a gatekeeper to those areas, because those areas can basically become real problems very quickly.
Right, and it's not as if you could test people to perfection, right? I mean, somebody could be tested today. We
Yes.
talk about it all the time in our own offices where there's remote work protocol and people are rotating in, 2 at a time to try to minimize contact. But someone could have been tested last Friday and somehow inadvertently made a positive contact, and all of a sudden there you go. Unless like in the VMC hospital where they're testing people pretty much daily that are in contact with patients, it's pretty hard to test ourselves into 100% reassurance, I guess, in any of these situations.
I think that's been also said. We can't test our way out of this pandemic, so we can't do that. So we test as best we can, but you're right, you test today and it doesn't tell you about next week. So we at least test, make sure you're negative, and say, okay, I'm going to really make sure that I don't put myself at risk or anyone else. So it's an extra added way of reassuring that you've done the right thing. And then going forward, you have to take that responsibility to maintain your safety.
Yeah, understood.
Yeah.
Tara, more questions?
Yeah, so the next question on Facebook is, with the 2021 school year about to start in a few weeks, what are both the county and districts doing to make sure students remain safe when it comes to learning?
Well, let me just say this much. First of all, one of the interesting things about schools, it's really almost a dilemma, is that we have so many different layers of jurisdiction. And first and foremost, I want to say I know that the Public Health Department and Dr. Sarah Cody, who I'll go back to the beginning of the show, was actually your hire at one time because you preceded her running the county Public Health Department. But that, she basically endorsed some county Office of Education protocols that our school districts in Santa Clara County came up with, guidelines basically as to how to open up with relatively small cohorts of students that would stay in the same cohort, almost like age-old schools when I was a little kid, where the same 15 kids would be in the same classroom all the time, or the same 12, I think, in this case. Meanwhile, governors, come out with state protocols that I think to some extent eliminated some of that temporarily and talked about we don't want kids coming in together, even in small cohorts. And then layered onto all that, we have about 30 school districts in Santa Clara County, and they have their own school boards, their own elected officials, their own superintendent. The law in the state of California says they have some autonomy in terms of how they run things. How does that all play in terms of predicting what's going to happen next with schools? I didn't mean to reframe the person's question, but to me that's kind of the question.
It is, and it's going to be a challenge for us because we don't know what level of risk. You've heard all kind of information about whether young kids really get sick from this, whether they can be exposed and get sick, or whether they in fact are great carriers of the infection. And we have seen data that says that young kids can carry a lot of virus in their nose and throat, and kids are germ spreaders, so you're not going to put a mask on them, a second grader, and expect them to keep a mask on. That's not going to work. So we want to make sure that all the protocols protect the teachers, especially also. And right now, I think the school districts, and rightfully so, have decided that most of those schools are going to start with distance learning.
Yep.
So we don't have quite the information. I think, given where we are as far as the number of cases, that I think that's a good idea. The governor has allowed some of them to submit a request for a waiver from that for the elementary schools, but we're still looking at that right now. But right now it looks like there's not going to be any mass in-person schooling when they do decide to open.
You know, I was just looking at some numbers that my communications department did in my own office from public health recently, and I was surprised that the positives were spread so evenly among different age groups. Now, when we first started shelter in place, it was almost commonplace to talk about this being an older person disease, and you know, somebody my age might be much more vulnerable than somebody 19 years old or 20-something year old. Now it looks like the percentages of positives are evening out somewhat among those age groups, and again, to go back to testing, which is, you know, what you're mostly focused on right now. This is Dr. Marty Fensterscheib, who's handling testing for the county. It's inconceivable to me, you know, with 450,000 kids in this county, or people under 18, that you could test frequently enough to keep them healthy in school or to keep them separated and quarantined. I can't imagine even the Board of Supervisors saying, Dr. Marty, we want to give you enough resources to just constantly test every child that's coming in and out of a school. I think you'd be overwhelmed. How do you respond to that?
No, you're all right. You're absolutely right. We can't test our way out of this, and the same goes for schools. Now, even given the fact that we think that kids do better when they get infected, they still, again, carry a lot of that virus around. So we're concerned about the teachers too, and the teachers are concerned also about each other. But and then just talking about the age grading, because I'm glad you brought that up, because the numbers of infections are across the age gamut. So I think that when you look at the numbers, you expect, well, I expect to see more people older, in the older age range to be infected. We see more people hospitalized and more of our deaths in the elderly population. But here's the number, half of all the cases are under 40 years old. Half of all the cases are under 40, and a lot of them, break that down, under 29, under 20. So it's evenly spread, young and old.
And they're just as contagious as somebody else as far as spreading the disease.
Well, that's the issue. They may do all right. If a young person has a strong immune system, gets infected, and we see kids out there at the beaches and pictures of them having a great time partying and all of this, what happens is they're infectious, they don't know it, they come home, and here it is, their grandparents are there in their house, or they go visit them, or their parents that may have other types of diseases, and here they infect them, and they get very sick.
Yeah.
So that's the issue.
Yeah, has been the scariest thing for me throughout this whole thing, the insidious nature of it. Early on, I was calling it the ghost virus because, you know, the person who doesn't exhibit symptoms like that but is a carrier is sort of a ghost in the community, in the sense that you see them, but you don't realize the virus is right there, kind of as a shadow that person's carrying around. And how do you combat something like that? Obviously, that's part of what we're fighting, what we're struggling with. Tara?
Yeah. So this texter mentions that their grandmother's in an assisted living facility. She's losing physical mobility and is also feeling depressed more and more. And the texter wants to know what is being done to keep our seniors healthy, both mentally and physically.
Well, there's, you know, huge behavioral health efforts going on currently. In fact, my office just proposed to the Board of Supervisors and the President of the Board of Supervisors, Supervisor Chavez, that we conduct an older adult summit. We'll have to do that by virtual efforts, Zoom and so forth, but we did it a few years ago to try to figure out how to approach older adults in a way that doesn't make them feel stigmatized, that they'll open up and allow interaction about the mental health or behavioral health side of things. Not so much, you know, hey, let us test you for COVID, but how are you doing? I mean, isolating. I have not been in the same room as my 87-year-old father and 84-year-old mother since very early March, maybe late February, and there's they have an extended family. I happen to have a large family, so they're in some communication with siblings, with their sons and daughters and so forth. But how about the folks who are just completely isolated? And maybe you, because you're in the EOC and because of your experience, you probably know a little more than all of us here as to how much those efforts are being ramped up to check on mental health.
Yeah, and it's certainly, I hate to think that it gets lost among all of this, trying to protect people and protecting them from what if they're not, especially in these elderly facilities where they live every day, I think, to have communication with their friends and their families. And so taking that away has been really, really difficult. My dad is 93 and he's in Florida, and I call him every day to make sure that he isn't going out or he's staying safe because I worry about him, but I can't go and see him. And my brother and sister who live not that far away, they're in Florida, I don't want them there either. So he's isolated, and he's somebody, I think older people, he loves to talk, and he loves to really be close to people. So I think it's a question. I think we have to figure this out, whether we figure out a way for those people to even see their families in a park across the way in a parking lot or whatever. But I think we need to figure that out because it's very, very important.
Yeah, and I guess we all expected that, maybe we hunker down for a couple of months and it'll limit the amount of mental health damage on all this. It doesn't change the equation. Just because there's mental health damage doesn't mean you can just open everything up and then have the other problem of a runaway virus. But it's certainly something everyone's paying attention to. And I see we have a caller in. I don't know.
Yeah,
While we're waiting for the next question, let me say one more time, we have Dr. Marty Fensterscheib here. From the County of Santa Clara, a longtime expert in infectious disease and viruses and pandemics, and this is just a huge opportunity. He preceded Dr. Sarah Cody at the County of Santa Clara, and he's working on testing now, if you have questions before we conclude today.
I hope we can I know that more questions are coming, but I just want to make one comment that I hope we can get to the point of dealing with also who else is, other than young people and older people that need to be hospitalized, but in our community, half of our cases are in the Latinx community.
Yes.
And I think it's critical, and we've been trying very hard to reach members in that community and to really help in any way we can to explain the importance of everything that we're talking about. Because the Latinx community is a quarter, 1 out of every 4 in this county are in the Latino Latinx community, but 1 out of 2 of our cases are in the Latinx community. So really important area too.
I'm glad you brought that up, and we've made a couple $1 million more in investments just in the last couple of weeks, and I know there's more coming to try to address the disproportionate numbers of Hispanics and African Americans and some other demographics, including some portions of the Asian community.
Yes.
County's paying attention to that, but some of it, I think you and I probably share a philosophy, and I'll say it unabashedly, is not because they're not paying attention or they're not trying as hard as everybody else. It's because the way that this society has developed over the years, early on with some significant structural racism, some of which still exist. We have people that are working twice as many hours as other people that are people of color, and if you're out there working 16 hours a day instead of 8, or 8 hours a day exposed instead of 8 hours a day telecommuting, you're at higher risk, and I think that's really what's happening. And I know everyone at the county is pulling out all the stops to try to address that.
Yeah.
Thank you for bringing it up.
Sure.
So the caller we had wanted to ask if the county's considering rolling back any reopening efforts and being stricter in our shelter-in-place orders to help curb the spread.
I hearken back to when Deputy County Executive David Campos was with us and said, we are evaluating those things every hour of every day. And that comment stuck in my head, and it continues to stick in my head. Would you endorse that comment? You're in the EOC. Basically, Mr. Campos was saying there isn't a minute that goes by that we're not looking at exactly what's happening and considering, do we tighten things up? Do we not? Where do we go? Maybe you
it's absolutely right. Every day we're looking at that, and we want, it's one thing you want something, And then on the other hand, the reality is if we do that, who does that put at risk? And so we want, but we want to do it safely. And Dr. Cody always talks about this. You know, maybe she's been a little conservative, and I totally agree. I don't even consider it conservative. I consider it the right thing to do. And so it may take us a little bit longer to get there, but we'll get there right, and we'll get there safe. And we want to protect lives. It's not worth a single life to go out on a limb and do something that's that's not safe.
And we have.
This is our last question.
Oh, great.
We have, and the question is, do test results come back in faster if they are positive?
The testing turnaround is such that if a positive test comes through, we put those in the front of the line. So you won't, when you get it, if I had 10 tests in front of me to run, I don't know which one is positive at the time. I have to run them all. But once I get all the results, if there are 2 of those that are positive, I'm going to take those 2 and say, you need to call these people right now. So we will turn those results around, meaning that we will let you know of the positive first, because we need to do something right away. The other ones that are negative, we will get back, but not before we do the positives.
Yeah, and if you had, I don't want to put words in your mouth, but it seems to me if you had the ultimate resources, the capacity to respond to all of them, as immediately as possible, you would do that. But it's kind of a triage thing, right? You have to make decisions. We have so many people and so many test results. Which ones, we can't get the answers to everyone today. Which ones do we get out? We better go with the positives. That's kind of what I understand you saying. And ultimately, hopefully, we get to a place where everyone can be notified, equally or as quickly as possible. I know that's what the public is looking for.
Yeah, we should turn those around in 2 days to 3 days, no matter what. And these outliers and the 10 to 15 day labs are just not helping at all. So we hope all of that will get better, but we've got more work to do on that.
Well, we're going to wrap up. It's been a great conversation today, thanks to you, and you've really given some very specific answers. I think probably people wonder sometimes, I try to do my best, but I'm an elected official and I'm kind of at the board of directors level at 30,000 feet up. We're dealing mostly with budget support, and we ask questions during public hearings, but it's so great to have somebody with firsthand knowledge and expertise and training and obviously medical credentials, Dr. Marty Fensterscheib, who's really given some very specific answers today, I think, that probably make people feel good and feel reassured that somebody's got their hands on the wheel here. And I know he's fully endorsed Dr. Sarah Cody's efforts as well. Dr. Marty, you want to close this out? Maybe, I don't know if you want to look in the camera and just let people know whatever you'd like to tell them.
Well, absolutely. Thank you. And the first thing I want to say is to thank Supervisor Cortese and the board, because I have worked in some other areas, and this board and this county has been the most supportive of any that I've ever seen. So we're very, very fortunate and lucky to have them be supportive of everything. Sometimes they ask the tough questions, but it's only because they care. The other thing is, wear that mask. Wear that mask. Stay safe. Keep your distance. And again, be patient. And remember, be good to one another. It's the virus that we're fighting, not each other.
Thank you so much. We'll see you all next week.